we have a discussion, and we welcome you all to be part of this discussion. Because it's kind of a problem-solving situation about what you would do in this kind of a situation where advocacy needs to step in. So the first scenario here is that with Carlos visited the doctor due to some PPS symptoms. And the doctor referred him to a therapist to improve his muscle strength by lifting weights and running on a treadmill. Now, those in the group, I would assume most of them would know that that's probably not the best strategy.
Probably.
So we're looking for feedback. So you go to the doctor, let's replace Carlos with you. And you go to the doctor and the doctor tells you to do this. What are you going to do? Constance, I know you have an answer to this.
Number one, change doctors. Number two, go to the physical therapist if that's what I really decided I want to do, and have a long heart-to-heart conversation about the fact that I am not their typical patient who sees physical therapists in order to improve a surgical result or an injury result. I am there for the exact opposite position in order to slow down any deterioration my body may be experiencing due to overuse, strain, stress, or other issues related to my post-polio. Every time I go in to see the physical therapist, his assistant, her assistant, one of the trainees, or anybody else, I have that look in my eyes and remember, I am not everybody else. I am here not to get better. I am here to get worse slower. And let's adjust what we do together accordingly. Are we on the same page?
Oh my God, I'm taking you with me to every visit, Constance.
Wow. It's so that's just the message. And I say it the same way every time. And I remind them because they forget, and it's their profession, and I understand that. Their job is, whoever they see is there because they had an accident, they had a surgery, they had something that happened to them that suddenly took them from doing okay to suddenly not doing okay with things they used to be able to do. And so the therapy program is get them better quicker. That's right. It's just they need to understand with PPS, we just want to get worse slower.
Perfect.
So our focus is different. I say that to them all the time, and you're all welcome to the phrase. It's a very, very easy phrase, and they do understand it once you get that eye contact.
Yeah.
Carla, you wanted to come in.
Oh, well, I can. I think I would start sooner with educating the doctor. That's a really inappropriate referral. And the doctor needs to know that so he doesn't do it to any other PPS patients if she knows any others. But the other part of that is that, oops.
No, I brought it back because I wanted to see how everybody, in case you put your hands up. So we know there's a scenario, so that's why I took it down for the moment.
Yeah, I think it needs to start with the doctor, and, refocusing the doctor's perspective on how to make a referral to physical therapy. And I would love to have a quote of everything the prior person just said. I didn't get your name. Constance just said. It was so good. And I would also say, don't ever go to a PT who's under 50 years of age. So I'm keeping it short and sweet rather than blabbing on because I'm a PT. I mean, it's a terrible referral. And hopefully, legally, if the doctor wrote that, the PT has to get back to the doctor and say, may I change what your goals are, doctor? because I can't do that with PPS patients. But that's a whole nother scenario.
Oh, yeah.
You know, I'm on lately a thing about people in authorities that we actually allow them to have a God image, and doctors are one of them. We are, in allowing them to do that, we encourage them to have that kind of an image. And they feel that, you know, what they're knowledgeable, and how are you to question their knowledge? So we ourselves as advocates need to change our thinking on that. Doctors can be wrong, and oftentimes are wrong. Doctors oftentimes won't give you enough attention to give the proper diagnosis that you need to have. And so advocates need to feel that you are the customer and you deserve to have the right treatment and diagnosis. And this is certainly not one. Phyllis has her hand up.
I thought that was very interesting. I think Saturday I was on a PPS group, and Carla was there. The doctor that was presenting, I think her name was Marianne, she was saying, you know, if you have an injury, yes, a muscle can come back, but a neuron is not coming back. And I thought that that was very informative, because as my doctor keeps saying, I should be doing cardio, and I go, I'm not doing it. I'm choosing my neurons over, you know, my heart. And he goes, well, I don't agree with you. And I go, well, maybe not, but this is what I'm doing. And I respect him, and he respects me. But I thought that pointing out that we're not really dealing so much with our muscles as we're dealing with these neurons. That's what we're trying to protect. And I don't think they address that.
Mm-hmm.
Stefan has actually put something into the chat which is interesting. He says, sometimes I think that a part of their profession, I think meaning the doctors, is to forget what patients are repeatedly trying to explain to them, as they cannot remember what all their patients need.
Right.
I think that's very, very true.
Mm-hmm.
And Dick has his hand up.
Yeah, I just would mention that some of these doctors are trying to see 2,000 patients. And, you know, my doctor said to hell with it and went into a boutique practice where he has no more than 300.
Yeah.
So.
Yeah. There you go.
Mm-hmm.
And there's another factor here that we're not talking about, and that's insurance companies. You know, the doctor's going to give you a diagnosis, and they're going to give you a therapy or whatever it is, and maybe the insurance company won't pay for it if you turn it down. So that's another factor that's motivating that doctor, is they get that insurance to be paid for.
Mm-hmm.
The other thing is that you've got to remember that in a lot of the areas, people are not covered by private insurance. It's by national services, like the National Health Service in the UK, Scotland, and places like that, and in mainland Europe, and so that one doesn't come in, and it's through. Hold on.
Okay, and we'll give you a few seconds here, John. So, I mean, the bottom line here is we're talking about advocacy. And I think we need to be comfortable enough with ourselves. And we're probably, in many cases, the people in this room are more knowledgeable than some of the doctors on PPS to correct the doctor, or at least make an informed decision, not necessarily have to bow down to the doctor and do what the doctor says. Not all doctors are like that, but many, once again, because we allow them to be that way. We allow them to be that way.
Dr. Sliwa, who spoke to our group, and I think I told the story. I was sorry he didn't tell this story, and I might have told the story to this group. And I went to see him 35, 40 years ago, and he wanted to put me in a long leg brace, and I absolutely refused. And I said to him, I still have quadriceps, I still have a calf muscle, I still have some movement. And I said, why would you do that? And he said, well, one day your knee is going to just be so unstable. And I said to him, thank you very much. And I left. And I used a curse word, I have to tell you. And I met him many years later in a different environment. And he looked at me and he says, you look familiar. And I said, yeah, you wanted to put me in a long leg brace. And he said, oh, you're the one that said F no. And I said, yeah, that would be me. And he said, you taught me the best lesson I have ever learned about post-polio. And that was that I have to listen to you. You don't have to listen to me. And
Yeah.
he said, I had no idea that what I did, he said, I would have ruined you. I would have changed your gait. I would have hurt your back. I would have changed everything about how you lived, because I thought it was the right thing to do without understanding what you know about your body. And he says, every single doctor I train now is told if it's a polio, you want to be sure that you ask them what they can do and what they can't do. Because we think you can do one thing and you do 27 other things that we didn't think you could do. He said, so he was extraordinary, and I still see him now. And he has learned a lot, and he's happy to share what he learns with the residents.
So what do we do in a situation when the doctor unknowingly is ill-informed about PPS? How do we deal with that situation?
I think it's what Connie said, you know, if you say, I'm so sorry, this is not acceptable to me, and perhaps I need to see another doctor, unless you're willing to engage me in a conversation about what I'm all about. And I would just say it just like that.
And I may piggyback on Ina, and she's absolutely spot on. One of the things that I think has also been marvelously helpful in my relationships with doctors, because when my ortho of 25 years passed away, I had a 6-year battle trying to find his replacement for that very reason. I also was very careful to select medically based, peer-reviewed articles about post-polio, and they're available. They're everywhere. I've collected hundreds of them over the years. And I pick 2 or 3 and I print them and I give them to the doctor and explain, I really, you know, when I do that and I find out that the doctor really isn't knowledgeable, but really isn't jumping to conclusions or whatever the case may be, then I have one kind of relationship with him. And I say, here, may I show you some articles that might help give you some background about people like me? And that's one option. If the doctor comes in with the attitude and says, because I'm going in there saying, oh, geez, I'm having a lot of pain in my knee. Oh, don't worry, honey. We'll just do a knee replacement. It'll be zip, zap, bim, bam. We'll be in and out. It'll be no problem. And I go, why would you want to condemn me to a wheelchair for the rest of my life? And just because I attack their attack right at the same level at the gut, all of a sudden I get this, what do you mean? And then when they start listening to the why of it, our relationship shifts. That's happened to me on 2 separate occasions. So a lot of it depends on attitude, and a lot of it is, are they open to it? Because my pain management doctor and I are just like that. We have that kind of really close relationship, and I work with the students that he teaches at the local medical university as well for the same reason.
Mm-hmm. Yeah.
Just before Carol comes in, I had a problem a little while back. I went in with a problem about my PPS, and I saw the doctor, and I actually showed them an article to do with a particular problem I had, in which case the doctor looked at it, said, oh, this wasn't done in Ireland, chucked it on the desk and said, I'm not paying any notice to that. And so which I turned around and said, and I'm not paying any notice to you, bye-bye, and walked out the door. And also reported them to the General Medical Council in Ireland for inappropriate behaviour.
I know.
Good for you. Carol's has her hand up.
Hi, Carol. Welcome.
Hey, nice to see you all. I've missed you guys.
We miss you.
Yeah, there's multiple sides to this story, and I think what we have to do is as we become educated, which is critical, we also have to realize that the vast majority of us don't have MD after our name. And there are a lot of good, honorable physicians. I've had both sides of this.
Yeah.
I had the doctor that told me there is no way my shoulder and arm should ever be this weak and had me hang off a door. Literally, I'm telling you, she took my left arm, I couldn't lift it, put it on it, had me hang. I went to her one more time and walked. I walked. But then in the last 6 months, I had a situation where I now walk like a duck, left foot out. You guys know what that is. And no doctor was going to put me in a CAFO, right? I thought this mofo's enough. I got this figured out. I'm the most well-educated old broad he's ever going to see, right? Well, I faked it. Let me tell you, when you walk in the office, nobody can fake it like me. I would make sure my toe was forward and whatever. And my physical therapist lost it with me. She said, "That's it, Carol, enough. Your back is a mess. You've got to get this fixed. No faking the gait." She knows me really well. So I told the doc, "Okay, I need you to assess my gait, but I'm not going to be putting one of those. I've got too many friends in the big braces." She did a full eval. And you know what she said to me, Carol? She said, "The biggest mistake I could make would be to put you in a CAFO." She said, "I believe the problem is your hip." I said, "There's nothing wrong with my hip. My hip doesn't hurt." And she said, "I believe the problem is your hip." And she did the test. And I have additional muscle weakness now in my hip.
And your adductors, right?
And yeah, that's one of the muscles they use and the whatevers and yeah. And that was such a critical lesson for me because then she had to deal with my head.
Right.
Oh, this is progressive. I'm following all the rules. I'm doing everything I'm supposed to do. And I still got weaker. So I think as patients and as survivors, we also need to be careful on how we approach a physician. And now she's like a riot. She said, "Yeah, you're a big fat fall risk, but you know it, so we're good." Handling me beautifully. I love seeing both sides of this thing.
Mm-hmm.
Love it.
Yep. I get it. I get it. Any other?
And I'm what I'm trying to, I guess, my message is that just realize that you have patients' rights. So you have patients' rights, and yeah, there are good doctors out there, and most of them are caring people. But they do sometimes have an attitude that I know more than you, and in many cases they do, but in some cases, particularly with PPS, they oftentimes are not as informed as they should be.
Mm-hmm.
And there are other people in that same situation that sometimes we allow them, and I'm using that word loosely, to be godlike. And you have lawyers, and you have politicians, and you have religious people that we all respect, but also they're we as advocates, when we don't feel we're being properly treated, need to feel respect for ourselves too.
Could I comment on that?
Sure.
There are some people that I worked with before I retired whose culture dictated that the priest and the doctor were at the top of the scale. And you didn't
Question.
Yeah, you didn't at all question them. I mean, your job was to sit, listen, and behave. And that's a very hard thing to break through and let them know what their power is and what they can do that's appropriate in this country. I assume it's the same in other countries. And the only way we were able to help parents, I worked with young children who had disabilities, but the only way we were able to break through that was to send an interpreter with the patient so that they didn't get walked all over. And the interpreter at times had to take over the role of the parent in advocating for the child, which I think is very difficult to do and also somewhat inappropriate. But teachers, physical therapists, those kinds of people are only slightly below the priest and the doctor in their culture. And it's a very difficult situation to teach advocacy to people who have a strong belief in that.
We get that problem a great deal in sub-Saharan Africa. We also get the problem in sub-Saharan Africa that we meet the shaman, the local. I'm not going to. I don't want to use the word witch doctor, but I think you understand what I'm getting at. The local healing person, and that they can actually they can really cause problems. They can really cause problems. One of the other things that people don't realize is that breaking that mold of the preacher, the doctor, etc., is not just current in various places. We meet it in countries which are in Europe and are active at the present time.
Yes.
Especially in southern Italy and in places like that. And the third one that comes in after that is, in fact, the banker. You usually get him in there as well.
Wow.
So we get that. So, but I don't know if there's anybody else want to come in on this bit, because it's good. Lewis, you coming from where you do in Nigeria, do you find problems in getting people in, so shall we say, Ajuba or Lagos to listen to you? Lewis, are you there?
He's there somewhere.
Lewis's symbol when he's not on screen is a football club badge, Arsenal, with a gun on it. He's in London. I was hoping. Lewis is originally from Nigeria.
So, I mean, the bottom line is that as an advocate, it's good to question authority. It's good to question authority and to feel comfortable questioning authority and not feel that you are beneath that person. And yes, that person has more information or maybe more knowledge than you have, but you also have you're concerned about yourself. And self-advocacy is, it's okay to question somebody of authority. And certainly in this case, the doctor is the person of authority. And if you are concerned that you're not giving you the right diagnosis, then it's okay to question that person. And actually, in your case, John, maybe it's not just questioning the person or changing doctors, but maybe that doctor needs a little bit of education that you have that he doesn't have because you have the symptom yourself. And I think it's healthy to do that. Constance? Constance, where did you go?
Who's there?
There we go. Sorry. I agree with everything everybody else has been saying. Absolutely. And that's kind of why a lot of times depending on the doctor and the relationship I either have or want to have with that doctor, I simply will either tell them, look, I fully respect you're the expert at medicine, but I need you to respect I'm the expert at me. So if we can partner together, I think we can have a really good working relationship. The other thing that I do, depending again on the doctor, the relationship, or what's going on, I also give them a little anecdotal story. It's kind of like when that chicken and the pig decided to open up a breakfast restaurant, and the chicken couldn't understand why the pig wasn't as enthusiastic about it. And the pig explained to the chicken, honey, for you, it's an investment, but for me, it's a commitment. And most of the time, that's the reaction the doctors have with me, and would break the ice with a bit of a giggle. And they kind of realize, yeah, that's true. I go on to the next patient, but you've got to live for the rest of whatever time together we have with whatever we decide. So yes, your investment is a very different one. And a lot of times that breaks the ice and helps us reach a better understanding.
I
good.
see Florence on the screen, and I bet you she's got something to say on it.
No, I came in late. I really know. I'm just
Yeah.
listening, catching up.
You know, it's like when a doctor gives you medication and you have a right for yourself to look at the side effects of that medication and read the side effects and understand them, not just accept the fact that the doctor may think this is best for you. So, I mean, I always look at the side effects when the doctor gives me medication. And if I don't like the side effects, I'll go back to the doctor and say, can you give me something else? Or is there an alternative choice to this? Because I don't like the side effects of it. So, you know, once again, it's kind of informing ourselves to be advocates. We need to make sure we understand.
One of the people in, I think it was Marcy's group a year or so ago, had been born in Mexico, I believe. And she was taken at 6 months of age to a curandero for healing. And the curandero said, go kill a cow, put the baby in the stomach of the cow for 2 hours. And when the baby comes out, they will be cured. The cow had been eating cactus immediately before it was killed. And the baby came out covered in cactus thorns, screaming, of course. And those kinds of things are still going on in various cultures around the world. And though the people who are doing that are doing it with the idea that they are curing the person, they're going to fix them. And those are going to be cultures that we have a very, very hard time getting to and having them become advocates for their babies. Was it Marcy?
And it's hard to change culture too, oftentimes.
It is.
Yeah, it's hard. And John had mentioned, and I don't want to get off subject here, but the people oftentimes in some countries, particularly in Africa, where they do have witch doctors, and they listen to the witch doctors because for generations, that's what you listen to.
That's all you do, yeah.
Right. So, and even here in this conversation, we're having a cultural discussion once again. When you go into that doctor, do you feel like you're worshiping that doctor, or do you feel like it's a partnership? No? And it should be a partnership.
It certainly should, Ken. And one of the strange things that actually occurs in the UK and in Ireland is the best partnerships that you get on old polios are the ones who are the doctors who have actually originated in the Indian subcontinent.
Yes.
Because they have met polio head on in real lifetimes and in real time. And they are prepared to work and they're prepared to learn and to be able to take things back. And a lot of them come over on rotation. And it actually works quite well. But they are working as a partner and they actually ask you exactly what you're feeling, how it's affecting. They're not only dealing with the physical side of things, they're asking you, how is it affecting you emotionally and psychologically, so that they understand your lifestyle, because your lifestyle can be greatly affected by PPS in altering all the things you wanted to do. I know that all the things I wanted to do, the things that I used to do, I can no longer do. Even if somebody chucked me up into an aeroplane, into the cockpit of a light aircraft, I've no longer got my license because my PPS has got too bad and they won't claim me for it. But, you know, it does affect you in more ways than one. And it's not just the physical side, it is also the emotional, psychological side.
Marcy has a hand up.
Yes, I wanted just to comment about what Carla said. That person did live in a very remote village, and so an organization, I think it wasn't Doctors Without Borders, but I think it was similar, came in, and eventually, by the time she was like 5 years old, she was taken to the U.S. and she lived there until she was like 18. And she was in the hospital, and they did lots of surgeries on her, and they really helped her out. And I think it had to be the intervention of, more medical advances to really help her out. But she lived in a very, very remote village. So that was part of the problem.
Yeah.
So another issue, I think, with the doctors, particularly for most of the people in this room, is when you go there and you have a symptom, and oftentimes the conclusion is it's old age. It's old age. And that's what you're getting old, and that's why you have pains, or that's why you don't feel well, or whatever. But it's not always true. You know, old age can be. Yeah, go ahead.
I do think ageism is a detriment. You know, the doctor's never seen you before. He looks at your chart standing at the door before he knocks and comes in and says, "Oh, 80 years old." You know, and I fight that.
Ken, the other one is
You're gonna
Ken.
mute me if we talk in the background.
Ken,
Martha, can you
Go ahead.
put yourself on mute, please?
There you go.
Martha? Thank you.
the other one is misdiagnosis.
Yeah, which happens a lot. I find that I don't necessarily trust the doctors in the emergency room, because they're usually the younger doctors, less experienced. So, or even to go to a clinic, sometimes you don't get the best doctors either. So they often misdiagnose you.
It's lack of knowledge and going through, because a lot of the misdiagnosis comes out as fibromyalgia, ME, those sorts of things, which can mimic. Dick, you've got your hand up.
Yeah, I just would mention that we are polio advocates. And, we need to, as we're doing here, take responsibility for educating the PTs and the doctors and whatever. And Diane Wall and I and a couple others are going over to the University of Florida on Monday to help teach in a PT master degree class, what polio is. And so they're going to get to examine us as polios, and we're going to get to share, back and forth, and hopefully so that when they graduate us with a master's degree in physical therapy, they'll know what a polio is and what they can and shouldn't do. So I encourage everybody here to do that, to be an advocate with your local educational groups, if you can.
There you go. I think that's excellent. Yeah. And particularly if you have something that you've been living with all your life, I'm sure you've read everything you can possibly read. If you haven't, you should be. So oftentimes you're more informed than the medical person is on the particular subject, because it's personal to you.
Yeah, it's the old story. Get them while they're young.
Yeah. And I wonder, and maybe I'm wrong, and once again, I'm stereotyping at this point, but how would a young doctor know anything about PPS? Nothing. And they could, but chances are they may not even know polio is, much about polio.
Only if their grandparent has it or had it. Oh, my grandfather had that.
And I'm at risk of stereotyping here, and I shouldn't be doing
I am
that. So, and we shouldn't do that either. So, there may be some young doctors that really took an interest in it and studied it in school.
Mm-hmm.
Just as an aside, I actually had a phone call just before this session started, and I was asked by this clinician who was actually trying to sort out some other problems for me, and said, "Oh, what's wrong with you?" And I said, "I had polio in 1949." And said, "Polio doesn't exist anymore." And this is a doctor today in Ireland talking to me and saying, "Polio doesn't exist any longer." And I said, "I think you and I, when we meet on Monday, better extend the session for 3 or 4 hours so I can teach you exactly where polio is and what happens to it. There are another 4,000 people in Ireland."
There you go. And it actually, in my thinking about my comments, maybe a young doctor might be open to, let me go research it. You know, let me learn about it. So maybe I'm wrong on that. The other thing, John, we've talked about in the past in medical school, how much time do they actually spend on polio?
European medical schools, 7 minutes.
7 minutes.
7 minutes. I can see Dick nodding his head. I
Yep.
doubt, in fact, in vast majority of medical schools throughout the US and such like, whether it's much longer than that. It's the thing, and the one thing that's been noticeable. You were talking about Hannah Wunsch earlier on. One thing that's been noticeable is her book has taken off and is actually starting to spread the word about what polio was and how it's affected ICU. And I'm doing a talk to a Rotary Club in Dublin, admittedly remotely, and we're turning it on its head, and we're using Hannah's book as the point that today they would not have the ICU, the techniques and everything else, which is the general population is benefiting from, if it wasn't for the sacrifice that we polios had done.
Right.
Frances has her hand up.
Okay, so maybe current doctors were deficient in their knowledge and exposure to in medical school to what polio is, and that there are people who had polio who are possibly their patients today. But most medical practitioners, physical therapists, doctors, nurses are subject to continuing medical education requirements. And it's at those seminars and sessions and conferences where we can advocate with Rotary or our local support groups to get them exposed to what they need to know about us.
There you go. And Florence?
I don't know about anybody else, but when I go into any doctor's office, my first question is, even before the hello, do you know anything about polio? And normal response is, well, I learned about it in school. So I take that to mean, no, you know,
No.
absolutely nothing. And then I sort of work the session into my needs. I know what I could do, what I can't do. I know what medication I could take. And I find on Facebook, the Post-Polio Coffee House, if you have a question about a medication, this Richard Bruno, he's fabulous. He'll look it up, he'll tell you what to do, what not to take, what to take. And then you get everybody else's comments. So, you know, in a way, we're really not, as maybe I'm wrong, but what I'm gleaning from what I'm listening to, and again, I apologize for the lateness, we are not at their mercy. They really are at our mercy, because if they don't do what's right, I don't know about anybody else, I open my mouth and I tell them that's the wrong medication, because that's going to do A, B, C, D for me. You have to find something else. That's it. That's all I have to say.
Thank you, Florence. Carol?
Yeah, to Francis's point, that's the reason we don't just attend, but we exhibit at our state immunization conference every year. And every year that we have this banner about post-polio syndrome and polio. And every year we get people, physicians assistants, nurse practitioners that are stunned that the word is even there. And we're happy if we get 5 in the day and a half that actually are focused and serious about working with us, taking our materials. We're successful because those 5 will bloom to 5 to 5 to 25 to whatever. But that's why I truly believe it's not what we say, it's how we say it and how we deliver it. And a lot of our delivery comes from the 3 of us that attend and do this. 2 are in wheelchairs and one's double braces, double crutches. And we don't have to say anything about our disability. That's very visible with the credible resource of information. It's not what we say, it's how we're saying it that I believe matters. And who we quote, who we cite.
One point, coming back to what Florence is saying about Richard Bruno, for those of you who are outside the US, be careful because the medication names change according to countries. So you've got to be extremely careful if somebody says it. And there are 1 or 2 cases where medication names can be the same and be for completely 2 different complaints.
So Dick, John, when you were in the hospital, did they keep you informed, or did you have to ask questions?
You ask questions all the time. You have to ask questions. You have to ask them what they're doing, why they're doing it, and going on from there. It was one of the things. One of the first examples, or one of the things that you should do, is that you're supposed to be communicated with before any procedure is done on you. When I went into the A&E department, first thing that happened was 2 nurses came in, took my arm and started hunting around for a vein. And I said, the vein's not, the only vein that works is up here in my elbow area. And they still went on and went hunted for one elsewhere. But the point about that was they didn't tell me that they had been instructed to come in to take a set of blood samples. It was just, we're doing this and that's it. And that is the worst sort of medical thing that you can actually have happen, because you need to feel informed. You need to feel as if you have got the power. It is you, and I'm not just talking about people with PPS, but you need to feel that you are the primary consideration, that you are being spoken to, and that you're being spoken to as a human being by another human being. And you're not a medical experiment or somebody who can just do as they're told.
And
Florence.
Have I
No, Florence, go ahead.
Okay.
I'm sorry, she had her hand up, Karen.
John, why would you let them do that to you? Why did you say something? Like, what are you doing that my doctor didn't tell me? Why did you let them do it?
No, we did say something. Don't worry about it. Don't worry about it.
Oh, you did? Oh.
Of course.
Well, I won't repeat the exact vernacular.
I find even on something simple, they come and take my blood pressure and they don't tell me what the blood pressure is, which is I need to know that. It's about my body. So, I mean, that's just a small thing, but they, like you said, they come in and do blood tests and don't even tell you what the blood test is for. So.
You have a right to your medical record, which is a legal document. Anything they enter into that at the computer or when they're doing it, you have a right to.
There you go.
Colin? Unless it may affect your mental state.
then you and I are really in trouble, John.
Carla,
No?
My fear on being hospitalized after, a surgery or any number of things, is being sedated so that I cannot ask. I had a 45-day hospitalization, and most of the time I fought to stay alert enough to be able to say, what are you doing and why are you doing it? And who ordered it? But it's really hard if you are feeling lousy enough to be in a hospital for 45 days
Yes,
to continue to advocate for yourself.
yes. Yeah. I had a gatekeeper. I had my close friend there, and her boss gave her 2 weeks off to be with me every single day from 7 to 7. And she was the gatekeeper. She
Wow.
she just asked every question that I was too messed up to ask. So I understand what you're saying.
For instance,
And that is so absolutely spot on. Between my husband and myself, we have had somewhere in the neighborhood of about 35 different surgeries, 3 kinds of cancer, and an 8-year battle with an autoimmune system, not to mention my polio. And I will tell you honestly, he is never in hospital, but that I am there 24/7 until he is released. And I tell you with all honesty and candor, there have been no less than 3 different times when my being there had a positive impact on him not dying as a result of it. So,
My friend
yes,
said she thought I would die
absolutely.
3 different times. I can only remember 2, but she was
Yeah.
pretty sure 3 times.
Right,
And she was there
absolutely.
to stay with that.
And we have to ask, we have to keep asking. And,
Yeah.
and it's not an adversarial, confrontational ask. It
No.
is I'm requesting additional information. I always have a little
Correct.
notebook. I write everything down. They
Correct.
question me about that. I tell them I do this because I know my memory will be faulty. This will give me a reminder so that I remember exactly what we said, exactly what you recommended, exactly what was done. I've also said I have to report back to my husband's family, to my family. So they're going to ask me questions. I want to be prepared. When you give them a legitimate thing and it doesn't sound confrontational, oftentimes they will listen with a different ear. And I kid you not a pound, they were going to give my husband an antibiotic as a result of spine surgery he had. And in the recovery room where they had allowed me to be with him while he was unconscious because of the way he came out of anesthesia, I questioned the particular antibiotic because it was not the name of an antibiotic. And thank you, John, for your point about different names in different places of drugs. I did not recognize that name. The nurse looked it up and told me what it was. And we found out he was deathly allergic to it, despite the band on his wrist, despite everything else. The doctor misrecommended that particular drug. It would have killed him. I would have been told in the waiting room that he had died of post-operative complications, because they would not have known to look for it, or for whatever reason just missed it. So I kid you not a pound, folks. It's the way to do it. And by the way, I would love to see this group put together a compilation book about not only our stories, but also our lessons that we've learned and the recommendations that we can give to other polios, other people with disabilities and issues, and the medical community. And I would be more than happy to help facilitate that, because that's a powerful book. And it's something this group can use for future sharing to distribute and disseminate out to others.
I
John,
need to
yeah.
leave, so
Yeah.
I've made John the host here. And just, I assume when I leave, everything will be fine. John, just remember that we're live on Facebook, so that any chatter afterwards, you may want to think about that. Okay.
Thank you,
Okay.
Ken.
All right. Thanks.
The one thing I want to say before we close out, because it's almost time, is that every once in a while, I feel the exhaustion. Here we are getting to have to live our lives in ways that other people don't. We have to struggle with what's going to happen and our disability getting a little more pronounced. And then we have to go to bat you know, for ourselves yet again. I mean, it's like we've all been doing it since we're children. And I get exhausted from that, the thinking about that. And yet we don't have a choice. And what we discussed today is tiring. It's just tiring. I want to be able to walk into a doctor's office and have him look at me and say, oh, you're polio with post-polio syndrome. Let's talk about that. It'll never happen. It will never happen. Every time we see a doctor, we will have to go through it again and again and again. So I just wanted to applaud us all for how hard it is just to be in this world and get things done and to speak our mind whenever we have to. But I know it's exhausting, and I just want to acknowledge all of that for all of us. Right. Thank you, Mona. I wanted to also say something I had written to Dr. Bruno. We had a conversation. I read a very interesting article in the New York Times about a group of residents in medical schools who had a memorial service for all the people who had donated their bodies to science, to their universities, and to thank them in this very moving way for that donation and what they learned from that. And so I thought, I really need to find a place where I would donate my body for a place where they would be interested in neurologic and polio, post-polio, to see what's what. And Dr. Bruno's response was a little disheartening. And he said, sorry, Ina, to donate your body, you would need to find doctors with a protocol to study the tissue. Unfortunately, no one is interested. And I thought, that's really bad. So if any of you know of anything, or we should start something, you know, yes, Carla?
My body is going to UCSF.
Is it?
Yeah, and I know that I was so thankful as a physical therapy student for the person who donated their body that I dissected, that I don't care whether they, you know, learn about PPS from me. I just feel like the donation is worth teaching.
Well, that, yes, I agree. And I agree, and we'll do that too. I was just hoping that there was maybe some neurologic place, you know, where it would help, where they would see the damage, they're up close and personal.
I pushed 4 different medical centers, and UCSF was the only one that would take me.
Okay, gotcha. Well, I'm going to look around here in Chicago so that.
Yeah, it has to be within 24 hours of your passing.
Yeah.
Otherwise, you're not fresh enough.
Oh, I'm fresh.
Sorry.
But you all know that.
Me too.
You too. All right. So I have nothing more to say today. John, do you have anything else to say today before you turn us off?
Florence got her hand up.
I
Florence?
think Florence is going to have the last word.
Florence?
Unmute yourself, Florence.
Unmute, please.
Better?
Okay. Yeah.
Thank you. 2 incidents. When my husband was in the hospital, I was paraplegic, and I kept saying to the doctor, do you check his skin? Oh, yes, every day. Every day I asked the same question. And by the time the man was discharged, he had 13 bed sores. By this time, yes, 13. That's number one. Number two, when he was in the hospital just before he died, the doctor came in and said, well, are you ready to pull the plug? And me in my mouth said, pull your own plug. I said, start the antibiotics. You haven't done that. If he's got pneumonia, start for that. Don't pull his plug. You know, I really don't understand them at times. I think they become so overwhelmed that they don't know anymore what they're saying. And I don't think they see us as people. That's the patient as people. I think they see us as an object, so much flesh. And I don't understand. But 13 bed sores, then they had to amputate his leg.
No.
Yes. So that was in Florida. Well, when you move to Florida, you get told, whatever you learned in the past, forget it. It doesn't apply here. It's a whole different country, different world. That's
I
it.
know.
Yeah,
I think
yes.
I think that might be an appropriate point to say Florence has had the last word, and a very poignant last word.
Yes, a very poignant first. Thank you, Florence, for always sharing what matters. Thank you.
You're welcome.